So I presented on the BRCA-DIRECT study. So we've just finished the study earlier in the year, and we're just presenting the final analysis from the study. So BRCA-DIRECT is a streamlined digital pathway for germline genetic testing for women with breast cancer. And at the moment, the pathway is quite labour intensive. So by doing it digitally, we're hoping that more women with breast cancer can have access to germline genetic testing, which is important for treatment decision making, as well as surgical decision making, as well as kind of future management of future cancer risks as well. So within the BRCA-DIRECT study, we randomised women one-to-one to have either digital information ahead of the test or have a telephone counsellor appointment, which is kind of normal standard of care for germline genetic testing. And within the study, kind of the findings, we found non-inferiority of digital information in terms of uptake of genetic testing, patient anxiety, patient knowledge, and we found really good levels of patient satisfaction with this kind of end-to-end digital pathway that we were trialling. And in terms of kind of the secondary outcomes, we had this hotline that we used throughout the pathway that patients could contact if they wanted more information about genetic testing, what the implications were for them and their family members. And we found that less than 20% of patients actually contacted the hotline, and the vast majority of calls to that hotline were administrative rather than clinical in nature. And you know, the actual kind of volume of time, it was less than 25 minutes per week based on kind of the 1,000 patients that we consented to the study who used the hotline. And then we also measured clinician satisfaction as well, and we found that when we asked them whether kind of how elements of the pathway compared to current standard of care, whether it was equivalent or superior, the vast majority of clinicians agreed in all areas that the pathway was better for the germline genetic testing.